This segment of Delmarva Life is brought to you by Delmarva Dental Services.
When you're happy and you know it, you like to show it with a big smile, right? But if you're missing teeth or you have dentures that sometimes slip, you might feel too self-conscious to show those pearly whites.
Well, there's an easy fix for that: dental implants. And as I recently found out, they can not only make you look good, but feel good as well.
Jim Stavely's first experience with dentures was not a positive one.
I had lost some teeth and so forth, and I went and got dentures, which did not agree with me totally. I didn't want anything loose. I wanted it all permanent.
So when Dr. Joe Harmon suggested implants, he figured why not, but admits he was a little nervous about the process.
A little bit. I mean, my first appointment I canceled, and then I said, I got to get it done.
And he did. Dental implants are titanium cylinders that are placed in the bone of the jaw. They're used to adhere individual crowns or teeth or even dentures. Titanium is used because bone actually fuses to the metal.
So you can use them when there are no teeth, or you could use them if you lose an individual tooth, if you lose a single tooth. Rather than doing a bridge where you grind down the adjacent teeth, you could put the single implant in where you don't touch the adjacent teeth.
Dr. Harmon says implants have been around since the 70s, but the way they're put in is more precise thanks to 3D imaging.
In the old days, you looked at a two-dimensional picture, and it's kind of like looking at a box. And you're 2D, you're looking at a square. If you're looking at a box in 3D, you're looking at a cube. So you can tell depth. You can even tell the bone quality, the thickness, the density, before you even go in there.
That way, Dr. Harmon knows the exact size of the implant he needs before putting them in. For some, the idea of anchoring titanium metal into bone sounds painful. Jim says it wasn't.
And the work that Dr. Harmon did, I didn't even feel while he was doing it because they had given you Novocaine, I guess.
Even after the procedure, Jim says he only needed an over-the-counter pain reliever. Once the implants are put in, it takes a few months for the bone to adhere, creating the strong hold for the teeth. In the meantime, patients wear a temporary crown or dentures. As for care, Dr. Harmon says implants are easier to take care of than your natural teeth.
Especially with people with dry mouth. And so we basically, you can have an implant, and it's a very good investment because people that have implants cannot get cavities, whereas we'll see people that have had a lot of extensive dental work when they were younger, and as they get older and they can't take care of their teeth, it fails, and it's like a nightmare.
And because the teeth are secure, Dr. Harmon says people are able to eat better than they did when they had dentures.
If they have dentures, they're floating around and they're eating mush and unhealthy things, and they can't eat fibrous food, they're not as healthy. So they're actually healthier, especially the people that are wearing full dentures and complete dentures. They can eat better.
Jim says the implants took a little time to get used to.
After years, your mouth changes physical characteristics. So Dr. Harmon even said that the tongue would have to get back into position again. And in a couple of weeks, I was fine.
Jim says they were a great choice, one he would recommend to anyone.
Absolutely, absolutely. It's the way to go, and like I said, they're permanent.
Giving him a permanent reason to smile.
And Dr. Harmon says dental implants do require yearly maintenance. For example, if they hold in a full set of dentures, you should have the dentist remove them and clean them. And if you would like to learn more about dental implants or Delmarva Dental Services, go to our website, DelmarvaLife.com, and click on the Show tab.